Interesting op-ed over at nakedcapitalism.com by, I always want to say Yves, Y-V-E-S. How do you pronounce that name? Y-V-E-S? Shano knows. He's gone. Yves. Anyhow, he says he's here. This discussion with the BBC gives a damning picture of the performance of the supposedly best of all possible worlds U.S. healthcare system in dealing with Ebola. Points out that Médecins Sans Frontières, Doctors Without Borders, has treated thousands of people in West Africa with Ebola and has seen 16 medical workers contract the disease. This hospital in Dallas has treated just one patient and already has 2 sick healthcare staff. In other words, we're doing pretty poorly, and we're doing it here in the first world. Doctors Without Borders is doing it in Liberia. So then they look into Medicare's most recent ratings. This hospital was well below state and national averages on assessments of its emergency department. For instance, it took an average of 52 minutes for an emergency patient to be seen by a doctor or nurse, twice the state and national averages. And then they talk about who is doing well with regard to this hospital. And this is very interesting. This is the recipe for CEO disease, Yves says. The leadership of Texas Health Resources may, in fact, be very typical of that of large nonprofit hospital systems. THR is such a system. Mr. Doug Hawthorne is the CEO who retired in September of this year. And he said, and this article about him said, in 1997, Doug Hawthorne helped reshape the healthcare industry in North Texas by leading the creation of Texas Health Resources, an alliance of Presbyterian Healthcare Resources, Harris Methodist Health System, and Arlington Memorial Hospital. By 2014, with more than 22,000 employees in fully owned and joint venture operations, Texas Health is one of the largest care providers in North Texas. For its 2012 fiscal year, it had $3.7 billion in total operating revenue, $5.3 billion in total assets. And then Yves goes on to say, for leading this system, Mr. Hawthorne made a lot of money. 2012, his base salary was $1 million. His bonus was $1.1 million. That's a mind-boggling amount of money for a guy who's just running a hospital. And he's not a doctor. He has no direct patient care experience, no public health experience, no biomedical or clinical science experience. He's a bankster. He's a businessman. The current CEO of Texas Health Resources, Mr. Barclay E. Bearden, who's only been on the job since September 1st of this year, was also hailed by the System Board of Trustees for his unique leadership strengths. Nobody knows how much money he makes, but presumably it's well over $1 million. We have a broken healthcare system in this country. This should be a wake-up call, a huge wake-up call. And it should also be, it should also point out to wealthy people, you can't hide from diseases. Franklin Roosevelt came from a rich family, and he had polio. He was in a wheelchair most of his life. He understood this stuff. But the Koch brothers think that, they're going to be able to absolutely avoid having a plumber come by or somebody who's going to mow their lawn or do the flowers on their grounds or something who doesn't bring a disease with them. I mean, maybe they've got a company-owned, city attached, like Pullman had, like George Pullman had back in the late 19th century, where you get a company-owned store for your employees, or a company-owned town for your employees, company-owned store. But I doubt it. This is showing the just buck-naked stupidity of libertarian and conservative ideology when it comes to our commons, particularly our healthcare commons, and why every other developed country in the world, they have dealt with Ebola patients in Spain. They've dealt with Ebola patients in, I believe, in France. I don't have the list here, but there's a number of countries that have dealt with Ebola patients. Some have lived, some have died, but nobody has infected hospital staff. Then you send them off to some hospital in right-to-work-for-less state, Texas, Rick Perry's Texas, and surprise!